Welcome to another episode of Curveballs and Lemonade. I'm your host, Judy Kogan. On this week's episode, we have Melinda Hughie Blalock. And to be honest, Melinda's credentials are so long, I'm going to have to read them. Melinda is a wife, mom, advocate, fundraiser, and former certified child life specialist whose work and life are rooted in helping children and families navigate challenges with hope and resilience. Together with her husband, Tim, of 14 years, Melinda is raising their two sons, Bauer, 13, and Beck, 12. Beck developed life-threatening epilepsy at the young age of 3 and spent years with uncontrolled seizures before undergoing epilepsy surgeries that changed the course of his life. After years of searching for answers, a neurogeneticist identified a rare genetic cause for Beck's epilepsy. Today, he's thriving, learning, and performing in musical theater, and he continues to inspire everyone around him. Melinda serves on the board of that local community theater where both of her boys love to perform. She's also a volunteer parent support navigator with the Pediatric Epilepsy Surgery Alliance, supporting families navigating epilepsy surgery and complex treatment decisions. But there's more. Melinda is an aspiring author and recently completed her first manuscript, a memoir about her family's journey through childhood epilepsy, advocacy, and finding hope in unexpected places. Melinda is here today to talk about Beck's pediatric epilepsy journey, what it's like parenting a medically complex child, and also to share another curveball, which is how she navigated her own life-threatening cardiac condition. Let's jump right in. Hi, Melinda. Welcome to Curveballs and Lemonade. Thank you so much for coming on the podcast to share Beck's story and also a little bit about your cardiac curveball.
Thank you, Judy. I'm happy to be here. Thanks for having me.
Oh, I'm so excited. Let's dive right in. Can you share how Beck's seizure journey began and what the early challenges were in getting a diagnosis?
So Beck was born a healthy baby boy. We noticed that he was having some developmental challenges and delays pretty quickly. So that was on our radar. Being a child life specialist and knowing about early childhood development and having a son that was just 1 year older, they were pretty glaringly obvious, but we could never really put our finger on what was going on. We started early intervention with him and just tried to manage having a pretty high needs baby. And fast forward a little bit, I was having my own medical journey. I was diagnosed with an aortic aneurysm unexpectedly. So looking back at this journey, I really was in survival mode. So not only was I healing from my own open heart surgery, but also trying to navigate having a child that I knew something was wrong, but couldn't quite put my finger on it. So around the age of 3, we saw a huge spike in behaviors and irritability, and something just was not right. And my gut was telling me something was wrong. So I had him sleep in our room. I wanted to just sort of evaluate, is he having night terrors? What is causing interruptions in his sleep? And I woke up to him having what was later confirmed to be a tonic-clonic seizure. So full body jerking, turning blue. I panicked. And he settled down. I called my pediatrician right away and went to see her the next morning. She referred me to a pediatric neurologist. And as is often the case, it was a several-month wait to get an appointment. And so during that time, he continued to have seizures several times a week in his sleep. And I was reporting them, trying to get in to see the specialist, and was just told that I had the soonest available appointment. So a couple trips to the emergency room where they really couldn't do anything for us other than to say follow up with neurology. So we were eventually able to get a sleep-deprived EEG, which was kind of the first diagnostic step in getting Beck diagnosed. So we kept him up all hours of the night, and he was only able to 4 hours, and he had to fall asleep. And so he had the test, and the test came back with some abnormalities, but was basically inconclusive. And when we met with the epileptologist to review the data, she kind of took my story, my patient report, and the data, and explained that in her opinion, she believed that he had epilepsy, which I'll never forget that moment, sitting in the room thinking, he has epilepsy. What is that going to mean for his future? Why does he have epilepsy? And I guess the look on my face was pretty dramatic because she said, epilepsy is nothing to worry about. Lots of kids have epilepsy. Most kids outgrow it. Within 2 out of 3 kids will outgrow it. So we'll start him on medication and he may not have another seizure again. But my mama gut was just feeling like that probably wasn't going to be our journey. I asked for an MRI and for some genetic testing, just kind of having one foot in the medical world, knew enough that that would be appropriate. And I was quickly shot down, saying that was way in the future and not appropriate right now, and just start the medication and everything would be just great. But unfortunately, that was not our story. And it went from there.
So, and by the time he got the diagnosis, he's like around 4, like around 4. Okay.
Just turned 4.
So, okay. And you're at one local hospital near your house and medication's not working. What happened next?
So the medication wasn't working and they added a second medication.
Okay.
And at that point, if your child continues to have seizures and you're at the therapeutic level, your child is diagnosed with drug-resistant epilepsy, also known as intractable epilepsy. And I still kept asking, like, what is causing this and what is going on? So I pushed for an inpatient EEG, and he had an inpatient EEG, and his EEG was completely normal. So much so that it made his neurology team question, were these really epileptic seizures or not? And it made me feel like a crazy person because I was seeing these seizures. My husband was seeing these seizures, and they just were very hesitant to agree that it was really epilepsy since his EEG was normal. So rinse and repeat. We did a couple of EEGs. Each time they were inconclusive. So most parents might be happy to hear that testing is normal, but for us, it just added another layer of what is going on. If his testing is normal, and like what is actually going on. So that led us to seek a second opinion. And that was really hard to navigate because I didn't want to offend anybody and I didn't want to burn any bridges, but I didn't have the luxury of like waiting around. I felt like his team was very reactive, but they weren't interested in like getting to the root of things. So we went to our second hospital and it was more of the same, normal EEGs. We don't know what's going on. Let's try another medication, still continuing to have seizures. And during this time, like his development had completely stalled. He had plateaued. He wasn't able to learn much. It was just really sad. He was just existing. We saw a third provider and just we weren't in alignment with the plan. And so then that led us to our fourth children's hospital where we were there the longest. And it was more of the same. Inpatient EEGs that were normal and having the team tell us things like, this doesn't add up, this doesn't make sense. Like, you're reporting that he's having these really serious seizures, but if he was, then it would be showing on the EEGs. And all I could say was, I'm not a neurologist, but I'm waking up in the middle of the night to my child Blue, calling 911 and watching him have seizure after seizure. Like, what are we missing? And they said, like, we don't know. Like, lots of kids have seizures. He has autism. So these may be epileptic seizures, but we can't tell you where they're coming from or what to do about it.
So how did that feel? Almost like they didn't believe you because the EEG was not recording his seizure activity. Like, obviously your mama gut knew that there was something going on, but that must have been incredibly frustrating on top of confusing to not understand what's going on. But how frustrated were you? And did you feel like you needed to have proof? Like, were you recording him? Like video recording him? Like, how did you feel and what did you do when that was going on?
Yes, it very much felt like I had to prove myself, like I was being interrogated. Sometimes I felt like they were trying to catch me with like an inconsistent story. It was really, really, really hard. At one point, I just sort of checked out and had my husband take over. I feel like their interactions were very different than mine. I will say this was during the pandemic, so there was kind of a different dynamic. Some of the visits were done over the video versus getting to see Beck. And it was just super, super difficult because I was trying to find the balance of not seeming like a crazy parent, but being like persistent that something was wrong.
Yeah. So at one point, did you realize, okay, we gotta go outside of California. We have to really get to the root of this because it feels like we're up against a wall with all of these epileptologists?
So at one point, one of the neurologists said to me, like, Melinda, we've done everything we can do and everything is normal. And I don't know what to tell you. Things are not adding up. And it's almost like you want there to be something wrong. Like we're telling you it's fine. This is not a big deal. And at that point, I feel like I had become a student of epilepsy. I was reading all that I could read and listening to podcasts and trying to connect with families. And, I was really cautious. I didn't want to offend anybody. I didn't want to burn any bridges, but I didn't have the luxury of just staying at this hospital because they weren't able to help him. And so it was at that point that I started researching other level 4 epilepsy centers, and there was a bunch of serendipitous events that led me to Memphis, Tennessee, to Bonheur Children's Hospital. I was specifically looking for a center that had something called a MEG scan, and there is not a MEG scan available in all of Southern California. At least there wasn't at the time. And in Northern California, there was a 6-month waiting list. And so my first call was to Bonheur just to sort of see what their process looked like and to get a MEG scan. And we kind of went from there.
Okay. And just so that we understand, Bonheur is about 1,500 miles from your home in Southern California, right? So that was a big decision to connect with a hospital that wasn't close. Okay. So how did all of that play out? Like once you kind of called them, like did you tell them Beck's whole story? Like here's what's going on, or did you just sort of take a step back, be like, okay, I'd like to make an appointment for you to see my son?
So I called the Epilepsy Monitoring Unit coordinator, and she spent over an hour on the phone with me. And I told her Beck's story, and I could tell she was sort of taken aback, but not surprised. She told me that they see kids from all over the country that have reached the end of the road at their local hospitals, and that at Bonheur, like they won't stop searching for answers, that they will get to the bottom of it. And it kind of surprised me. She said, basically, how fast can you be on a plane? And I later learned that it was because she was nervous that time was running out. In other words, Beck was at large risk for something called SUDEP, which is sudden unexpected death in epilepsy. I think there's 7 risk factors, and he had 6 of the 7 risk factors. And that's where children just unexplainedly have a seizure in the middle of the night and pass away. And that was on her radar. The things I was telling her made her concerned about that. So within 3 weeks, we had our plane tickets booked to spend a week for a formal evaluation that would include the MEG scan.
Okay. So let's talk about that experience there. Did you take the whole family, first of all?
So that was a lot to navigate. At the time, Beck was 7 and his brother was 8. And we went back and forth on what the best thing to do would be. And ultimately, we decided that it would be best for our older son to stay at home with his normal routine and to be cared for by someone he was comfortable with. So thankfully, my mother-in-law was able to fly in from across the country to take care of Bauer. And we didn't know if this was just going to be a one-time thing. I mean, our main goal was to have this MEG scan and see if there were any answers. And it was a lot of sacrifices. Financially, it was a lot to pay for airfare and to cover all of the things that were not covered by insurance, but it was a sacrifice we were willing to make. And at this point in our journey, I was about to just give up and just like accept, like, this is just the way it's going to be. We're never going to understand, and we'll just keep trying medications, and maybe someday he'll outgrow it. And so I was really pretty discouraged at this point. But my intuition was saying, go for it. You have nothing to lose. And so we flew to Memphis, and I always say that we learned more in the first 4 days than the previous 4 years combined. Like the team immediately welcomed. And one of the first things they said to me was, I'm sorry that you've gone through this. Like, we believe you. We don't know what's going on, but I can assure you, like, we're going to leave no stone unturned, and we are going to figure out what's going on. And I could just finally, for the first time in this journey, like breathe a sigh of relief. Like them hearing the words, I believe you, was what I had been trying to experience in all the other programs. And they could clearly see. And I had videos of Beck. I had everything documented. And his epileptologist is just used to seeing kids that don't fit in a neat little box. And so I can talk a little bit about what the week looked like, if that would be helpful.
Yeah, I was going to ask, like, how quickly did he have the MEG scan, and how quickly did you get information? Learn a bit more about that information that you learned in those first few days.
Yeah, it was super helpful because it was just everything was done right at the, during that week. So we weren't having to do outpatient visit versus outpatient visit. They were able to do it all. So during that visit, he had a MAGE scan, which a MAGE scan was kind of the missing piece for us. EEGs can only measure like just below the surface, and the MAGE scan can use magnetic fields to be able to look deeper in the brain. So he had the MAGE scan, the MRI. He had a full neuropsych exam, as well as some brain mapping, and then continuous video monitoring for 5 days. And in true Beck fashion, like his brain did not perform the first couple of days. And I thought, oh, here we go again. But the MAGE scan did show that he was having seizure activity, quite a bit of seizure activity. And so I was like very thankful that we actually had some data. And his team was like, this is really puzzling. Like, he should be seizing by now. Like, he's off medication. But never once did they make me feel like I was crazy. They just kept saying, like, this is unusual. Like, let's just give it time. The MAGE scan showed us that his seizures were in the motor pathway. And so that limited, like, other treatment options that were for him in terms of epilepsy surgery. He wasn't a candidate to have a resection or an ablation because of where the seizures were located. And at that time,
just for those people who aren't familiar with that term, resection is not just limited to the brain, but any part of the organ that's being removed. And then, okay, sorry, I didn't want to interrupt you, but go ahead.
Oh, no, that's okay. Yeah, my understanding is they can actually remove the part of the brain that is causing the seizures, and it can be a cure for many, many kids. So that
he wasn't a candidate.
He was not a candidate, but he was a candidate for what is known as neuromodulation. And so it was at that point that we were introduced to a vagus nerve stimulator, which is VNS for short. And a vagus nerve stimulator, the way I think about it is it's sort of like a pacemaker for the brain. It's implanted in the chest, and the electrodes stimulate the vagus nerve. And then the vagus nerve stimulates parts of the brain, and the thought is that it will interrupt seizure activity. So it's constantly running in the background. Okay. And one thing that they know about VNS is that it does reduce the risk of SUDEP, which is what I mentioned before, which Beck was at risk for. And it was a lot to take in. Like, we weren't planning on going to Memphis and having surgery, but it just sort of was all falling into place. And at that point, we were planning on moving forward with the surgery, most likely, even though he hadn't had seizures while he was on the EEG. So the EEG tech came in to take off all of the leads, and she forgot glue remover. So she stepped outside of the room, and Beck just started seizing like crazy. And his doctor came in his cowboy boots, and he was jumping up and down like, good job, buddy. Like, I knew you had it in you. Like, and he said, well, Melinda, you said you were looking for your sign. Like, if you were looking for your sign, here's your sign. And we were able to capture all the things we had seen at home. And you asked before about videotaping. His seizures were like 45 seconds or so. And so we tried to record it. We were able to get like the tail end of the seizures. But unfortunately, when your kids start seizing, there's never a cell phone nearby that you can just run to. By the time you get the camera open and you start recording, it's too late. But we were just
so relieved. You're also worried about your child's safety and
exactly
all the things.
But that was a question. Like, do you have any videos? And I always would say, like, I'm not the only one that's observed these. Like, my family's seen them. They've seen them at school. Like, just because I didn't want them to think that I was exaggerating. But that's how it felt sometimes.
No, and I didn't mean to suggest that you needed to have video, but I almost feel like for when you're faced with medical community members not believing you, like you're sort of stretching for like, no, this is really going on. Let me show you, because you can't see it.
And building your case, and just
which is so ridiculous, by the way.
Yeah, and being treated like you're just like a hysterical parent. And I had actually experienced that in my own healthcare journey, which I feel really prepared me for my journey with Beck to just continue to push and to advocate. So fortunately, I had that experience with my own health, but I wish I didn't have to advocate that hard.
No. And I'm going to get back to your own health. I want to finish up like the first part of the VNS. So, okay. So you're there for the first time in Memphis. Like, obviously surgery was the right decision from the medical team's perspective, from you and Tim's perspective. So like, did you stay there and do it, or did you go home and come back?
So I just threw it out there. I was like, well, we're already here. Like, is there any way we could do it now versus flying back home and coming back? And his epileptologist said, I don't think so, but let me reach out to the neurosurgeon. This was on a Friday afternoon. So the next thing I knew, the neurosurgeon was in our room, and she was explaining the surgery to us. And I said, when do you think we would be able to have the surgery? And she said, you know what? I'll just do it this afternoon. I said, on a Friday afternoon? And she said, yeah, it's okay. Like, I don't mind staying late. And again, we were just like so blown away that they cared so much about my child to work late on a Friday night. And Beck was the only one like in the recovery room. Like everyone else had gone home, and there was just Beck and Tim and I. So we stayed, and he stayed overnight. And then so we were on the weekend at that point. They turned on the VNS and they program it. So over a 2-week time period, the device is, I guess you would say, calibrating.
Okay.
And so we learned all about the VNS, and we went home the following Monday.
Okay, let's go back for a second because I want to get there. Okay, 2 things came to my mind. Number one, like, how did you explain that to Beck? Like, hey, buddy, you're going to have surgery in like right now. And then okay, that's the first question I have.
So I had to lean on like my child life specialist skills, like what I would do if it were not my child, but it's totally different when it's your own child. And so I had explained to Beck, like, Beck, you know that your brain is very sick, and we've been trying to figure out how we can help you. Like, the medicine isn't able to help you. And what we want to do is we want to put something that's called a VNS. And I showed him photos of it in your chest. And its job is to tell your brain, stop, seizures, stop. So I showed him like what it would look like, that there would be a small incision in his chest and another incision in his neck so that he could see what to expect. And I explained to him all about the anesthesia process, and that mom and dad would be with him when they gave him the medicine that would help him go to sleep, and that we would be there when he woke up, and just gave him the opportunity to ask questions. And he really didn't have a lot of questions. I think he just kind of took it all in stride, and he trusted us that we were making a decision that was in his best interest.
That's so great that he had that faith in you and was willing and able to go through with it. So let me just ask, I guess my second question is, okay, so chest, neck, and then like how does it go to the brain? Like
Yeah, so my understanding is that the vagus nerve is stimulated, and then from there the vagus nerve stimulates the brain to interrupt the abnormal seizures. It's really cool. It runs in the background, so every 5 minutes it will pulse for 30 seconds, like to try to interrupt anything that's going on. And then if he's having a seizure, you can swipe the magnet and it will give like a burst. And the idea is that it will either stop the seizure or shorten the length of the seizure.
Okay. Yeah. And so then you were saying that like there's like a period of time when it's like you said 2 weeks where it's sort of like calibrating to that's so like can you talk a little bit about that? That's such a cool thing.
I don't really understand it, but I just know that they showed me a picture that like every Saturday it would just kind of ramp up a little bit at a time until it got to the level that they were comfortable with.
Okay.
So that was an automatic process. And then we returned 6 months later for them to check everything, to repeat the MIG scan, to see how everything was going. But my favorite part of this story is that we just saw immediate improvement of quality of life, like within a few days. And it was almost like surreal. Like, how is this happening? His speech,
like the switch was literally turned on.
It was literally a switch. It was like life before the VNS, life after the VNS. And they were really realistic with us. They said, in about 50% of patients, the seizures are reduced by 50%. So by no means did they promise that this was going to be the magical device to stop the seizures. But we thought about it as another layer of protection and one more thing to help combat these seizures. So we noticed immediately his speech was clearer, his mood improved a ton. He was less irritable and just so much more even. And when he returned back to school, I was curious to see like what his teachers would say. He was in a special education class, and the first day I picked him up, they were like, "This is crazy. Like he's like a totally different child." And I said, "Yeah, that's what we were seeing as well."
Oh, that's so great. So great. Okay. So you went back 6 months later, and what's the protocol? Every 6 months, every year? How did that work?
Yeah, so there is a little paddle where they can they put it on the VNS, and then all of the data syncs to a laptop, and they're able to see, how many events there were and when the VNS was going off. And so they checked it, and they made slight adjustments, like they turned it up a little bit. You can turn up the frequency and the intensity. So
Okay.
I don't understand the intricacies of all of that, but that's all part of the plan. So unfortunately, it didn't reduce his seizures, but we were seeing so many other quality of life improvements that we considered it to be successful, and we were happy that we made that decision to move forward with it.
And then at one point you made the decision to have a second surgery for a different device?
Yes. So with the VNS, the belief is that it takes about 2 years to reach its full potential. So when we were approaching the 2 years, I reached out to his epileptologist and I said, it's great that we're seeing all these improvements, but what's next? And I had heard about a new device that, it's newer on the pediatric side, but it's called a responsive neurostimulator, or RNS for short, not FDA approved for children under 18, but used on a limited basis. And so when I inquired about it, the epileptologist said that was already something that they had discussed as next steps for Beck. And just to buckle up, because can be quite the process to get approved from insurance, but I was willing to move forward with trying to get it approved. And fortunately, we were able to get it approved without having to appeal. So for the first time in the journey, something went really easily. But I think because he had already failed a device and failed medication, like this was the only thing that was left.
Okay, so so did he have to go through like a removal of the VNS and implantation of the RNS? Same surgery?
No, they actually leave the VNS in, and they work well together. So the VNS stayed in, and then we had another surgical evaluation to see if he would be a candidate for an RNS. And so we repeated the MIG scan, the EEG, the MRI again, and we had something that's called a stereo EEG, which is where they put intracranial electrodes. So they actually put the electrodes down into the brain to see if they can find the seizure focus. So he had that SEEG done, and that kind of confirmed that we were making the right decision and helped dictate like where the best place would be to put his leads. Without going into too much detail, his leads were placed in the central median thalamus, which is the major intersection in the brain. So some children are only candidates for RNS if they have a seizure focus. So there's 1 or 2 areas where the seizures come from. Beck's seizures were all over the brain. And the research was just emerging that there was success in the central median thalamus. And so that's where we decided to move forward with.
Okay. And how long ago was that?
It was 26 months ago. So April,
So you went back to Memphis, had them do that. I'm going to call it an upgrade. It's an upgrade or
2.0.
Okay, Beck 2.0. Okay, and then did you see the same sort of amazing developmental changes after the RNS device that you saw with the VNS?
So Beck had one big seizure after the RNS was implanted, which they told us was to be expected. Like the brain is settling down, major seizure. He had one major seizure, which they said was to be expected because the brain is settling down. And obviously they've done a significant neurosurgery. So he had one big seizure on day 2, and that was his last seizure. And so we just
26 months ago?
celebrated. Pardon me?
26 months ago?
Yep. So we celebrated at the 1-year mark, and I think his team is like very protective of my heart. They were like, this is great, but just know, like, statistically, the seizures will come back at some point. And I said, well, we're just happy to have this. I mean, we celebrated at the 6-month mark. We did a big photo shoot. We celebrated at the 1-year mark. And then we just had more and more seizure freedom time. So we just celebrated 2 years seizure free.
Amazing. And when you say celebrate, what are you doing to celebrate?
Well, the color of epilepsy is purple. And so we had a big purple party and had a cake and celebrated and just made a big deal about it. So it was fun.
Amazing. What does it mean, not just for Beck to be seizure free, but like your whole family to not have to worry, about, if and when he's going to have another seizure?
Well, it is still kind of always running in the back of our minds. So we're not able to really put our guard down. But I will tell you that I didn't sleep for 8 years. 8 years, I was checking on him constantly, never knowing if he was going to have a seizure. So for the first time within the past 6 to 9 months, I've been able to finally train my body to like relax a little bit. So yes, it's always running in the back of our minds, but we have some peace knowing that we've had this stretch of time without seizures. Beck's neurosurgeon actually said it best. He said, in some ways, the seizures are the easiest part of epilepsy. It's everything that comes along with the seizures. So all of the behaviors and uncertainties and worry. And I would agree with him in many ways. As difficult as the seizures are, it's everything that comes along with it. And so it's afforded our family to have some normal experiences. There was a time where we didn't know what Beck's future looked like. And so we weren't able to take vacations and we weren't able to just fly by the seat of our pants. We always had to make sure that we were close to a hospital and have a contingency plan. And so just being able to have freedom to do what typical families do has just meant so much to us.
That's wonderful. Linda, let's change gears a little bit. You talked earlier about when Beck was young, like very young, you had a dissection, aortic dissection, and you recently underwent another cardiac procedure. So let's talk a little bit about that. First of all, how long ago, what happened and how long ago was it?
So when Beck was 3, so right before he was diagnosed, I had an ultrasound on my neck and they found like a small mass and they weren't sure what it was. And so I had a follow-up MRI and the MRI tech overshot the image and got a little bit of my chest. And there was a lymph node, I say in quotation, on the MRI that raised some suspicion for me. And I asked if we could investigate like what that spot was. So the doctor reluctantly ordered a CT scan, assuring me that it was going to be normal. And we did the CT scan. And that same day, I received a call from the office saying that my CT results had come in and that I had a thoracic ascending aortic aneurysm and dissection and that I would need to follow up in the morning with a cardiothoracic surgeon. To which I Googled, like I said, I think you have the wrong patient. Like I had a nodule in my neck, like aorta, and I Googled it and it said, the Google result said almost always fatal. And I remember just being like in complete shock. And at the time I was having like some chest pain and some jaw pain and some face pain, which we now know was not related. It was a sinus infection. But because of that, it encouraged me to go to the emergency room just to kind of double check it. It's kind of funny, like the day before I didn't know I had anything. And then once I knew, I just felt like I had this ticking time bomb. So I went to the emergency room and again, the emergency room doctor told me that I must have been mistaken, that he didn't think I heard right, that healthy 37-year-olds don't have aortic dissections. Like, I didn't have any of the risk factors. And I said, well, then test me again. And he said, I can't test you again because you've already had contrast. And I said, well, then do an MRI without contrast. And so they reluctantly did an MRI without contrast. And I heard him in the back say, like, some profanity, like, oh no, yes, like, we found something. And I said, oh, and he's like, you have an aortic aneurysm and dissection, and it's like, this is an emergency. And so from there, I was connected with a local cardiothoracic surgeon. And one of the blessings is that because I had a sinus infection, they were not able to do emergency surgery because they had to wait for that infection to clear. So that gave me time to, like, collect my thoughts and do research and make sure that I could have the best team for me. And so I'm really grateful that I found a team in San Diego that was able to do surgery and fix me.
Wow. And this is, well, again, like as you mentioned before, this is while you're navigating the early stages of Beck's initial diagnosis. And then can we talk about more recently, like, because, Beck's stuff isn't enough. Can we talk more recently about the further cardiac issues that you had?
So at the time, the best course of action was to repair my aorta. So they repaired the aneurysm with a graft and replaced my aortic root. And unfortunately, it didn't last. So over the course of several years, my aortic regurgitation, which is like a leaking valve, became more and more significant. And I wasn't able to address it because we were so focused on Beck, but I knew eventually the symptoms were worsening. I was having shortness of breath and severe fatigue. And it was actually Beck's medical team that was like, well, now that Beck is doing better, like, how about you deal with your own health? And so about a year after Beck's surgery, I started doing evaluations for next steps. Really wanted to avoid open heart surgery, but ultimately that was the best course of action for me. And I found a specialist, of course, not at home, but in Cleveland, Ohio, that specializes exclusively in aortic valve replacements. And I went to get an evaluation just to learn more and felt such an amazing connection to her that I decided to have surgery at the Cleveland Clinic. And much like Beck, it was not convenient. It was very logistically challenging, big financial sacrifice. But as my husband said, you only have one brain and you only have one heart. And I wanted to make sure that I had the best outcome possible. And thankfully, that's exactly what's happened. I feel amazing and just am so grateful to have this second chance.
Timmy is so right. One brain and one heart. Let's talk about the logistics. What did that look like? Your family being here in Southern California, you traveling, going through. Now it's a valve replacement is open heart procedure.
Yeah, it's open heart surgery with a mechanical valve. So just the way that things go, my mom had her own cardiac emergency about 3 weeks before my surgery. So we had to pivot. She went into cardiac arrest and ended up having to get a pacemaker and a defibrillator. And she was supposed to be like my support for my surgery. So thankfully, I have a large family and we just moved some stuff around. My brother flew in from Atlanta to take care of my mom so that my dad could come to Cleveland to take care of me. We made the hard decision for Tim to stay home with the boys, which was, no pun intended, really heartbreaking. Like, I couldn't imagine going through the surgery without him, but we knew that that was where he needed to be because I can't imagine being across the country and there being an issue with Beck or with my other son. And so we made the decision for him to stay at home. I had my surgery with my dad in his 80s at my side. And then Tim flew to Cleveland to pick me up to help with the air transport home.
Wow. Talk about curveball after curveball after curveball. That's a lot. Now, as the parent of a medically complex child, what was it like having to go under anesthesia, open heart surgery, in the Midwest with your family home in Southern California. How did that feel as a mom?
So my children were really the reason why I went to the lengths that I went to make sure that I had the best team possible, with the best chance of outcomes, because I know that my children deserve to have a mom that's healthy and strong and has energy and is able to keep up with them. And so I always kept that as in the forefront of why I was doing this.
You talked about this before a little bit, but parents of medically complex kids often put themselves last. What would you say to a caregiver who's ignoring their own health right now?
I think we just encourage them. It's the whole analogy of put your oxygen mask on before you assist others, and you can't pour from an empty cup. And as cliche as that is, we have to be at our best. I've been on a journey the past year and a half trying to be the best that I can physically and mentally, because taking care of medically complex children, you have to be at your best. And I would just encourage people to know that, like, it's worth it. You're worth it. And that you're going to feel so much better once you address whatever you need to get taken care of.
Yeah. And you're feeling good today?
Yeah, I feel really, really good. I actually completed my first 10K after surgery. That's what I used as a goal. Yeah, I used that as a goal when I was in the ICU. I said, I am just going to walk and walk and walk. So I started training the day I could. I would take laps around the hospital. And so at the 6-month mark, I did a 10K.
Wow.
And then I got this crazy idea to do a half marathon. So I'm doing a half marathon in December, along with some of my friends. We have a team, and it's enough to keep me accountable and on track.
Wow. Amazing. Okay. Let's go back to Beck. What advice would you have for families who are struggling to find answers for effective treatment for a child with epilepsy?
I think my biggest piece of advice is to trust your intuition. Like, you are the expert on your child, and you know when something isn't right. And as a parent, it's your right to get a second opinion. And if you're not happy with the answers that you get from a second opinion, continue on. It took 5 children's hospitals before we were finally able to get Beck the help that he needed. And I know that it can seem awkward at first. You don't want to hurt anybody's feelings. But that, I know for me, that was a struggle, but I had to just keep thinking that Beck deserved the best and that hope was out there. So just keep searching for answers, and just follow your intuition and continue to advocate and be your child's voice.
That's great advice. What do you wish more people understood about medication-resistant epilepsy or intractable epilepsy and the challenges that families face?
So one of the things that I struggle the most with is the guilt of the years that we lost. I think, why couldn't we have gotten to the point where we are now so much sooner? And I think that is the misconception, that families don't know about surgical evaluations. Even their own teams will say, like, surgery is a last resort. We need to try this first. We need to try that first. But statistically, they know that if a child fails 2 medications that they're at a therapeutic level for, it's clinically appropriate for them to have a surgical evaluation. And a surgical evaluation doesn't mean that you're signing up your child to have neurosurgery, but what it does mean is that you can gain valuable data to help inform next steps. And so I'm really passionate about sharing Beck's story, because it wasn't something that was even on the radar. In fact, the first 2 hospitals told me Beck would never be a candidate for epilepsy surgery because his seizures were generalized on both sides of his brain, which is not true. And so it took me researching on my own to know that he was a possible candidate for it.
And thankfully, you did do that research, which leads to my next question, which is, how can communities and healthcare systems better support families with children like Beck with difficult to treat seizures?
I think early detection is so critical. I have a friend that 2 weeks ago, her daughter had an unexplained seizure and she went to the emergency room, and the emergency room physician said, well, everybody gets 2 free seizures. Like, it just happens. Like, sometimes you just have seizures. To which I said, like, that's absolutely, not true. I have another friend who, they kept saying that they were febrile seizures, but the child wasn't sick. Like, the child would have a seizure and then develop a fever. And I'm like, that's not a febrile seizure. So just early detection and taking seizures seriously, like they are a medical emergency. And I think sometimes they're just brushed off as like super common. So early detection and access to care. And that may mean that you have to look outside of your local area. We have many children's hospitals here in Southern California, and there's a shortage of specialists, and there's a lot of kids that need help. And so just pushing for access to care, and just building a community. Like, I am really involved with our Epilepsy Foundation and with local parent support groups. I am going to Zion in 2 weeks with 25 other epilepsy moms.
Wow.
And I'm really looking forward to it. I'm hoping that I can be a resource to families that are newer in the journey, and that I can also learn from caregivers that are further down the road. So building a community, early detection, and pursuing epilepsy surgery evaluation sooner in the journey and not putting it off.
Great. Very, very sage advice. What made you decide to become a patient support navigator with the Pediatric Epilepsy Surgery Alliance? And in that capacity, how are you working with families?
I think that I want to be of service to families because I did not have that support. I felt very alone in this journey. I didn't have anyone to connect with to cheer me on and to encourage me. And so as a parent support navigator, I'm matched with other caregivers who are facing a similar journey. Maybe they're exploring having an RNS or a VNS, and I'm able to share my experience and to give them a place to ask questions and to encourage them to advocate and empower them to get second opinions and get their questions answered. And I get so much more out of it than I give. And I just love being able to be that resource for other parents. And then in turn, they're able to help other parents.
I love that you're able to pay it forward in that way. It's really, really remarkable. Last question for you is, what's your hope for Beck's future, both medically, developmentally, personally, all that stuff?
So it's such an interesting question. Beck is seriously the happiest child I know. Like, he wakes up every morning. I hear him say, "It's such a beautiful day outside. Like, what are we going to do today?" He never meets a stranger. He is just happy and joyful. And our hope is that we can continue to nurture him and give him every opportunity to continue to have that joy. We don't know what his future is going to look like. We suspect that he will always need support in some capacity. And our commitment is to make sure that he always has that support. And the sky is the limit for him. We were told that he had a neurodegenerative epilepsy and that he may never acquire new skills. And he's a kid that works 100 times harder to be able to learn what he needs to learn. And it's been a joy to watch him. His love is musical theater. So he loves to perform. And all of the years of hundreds of hours of therapy, like, to see him on the stage with typical peers doing what he loves is just so gratifying to me. Right before I had my open heart surgery, he had a voice recital and he sang the song "You'll Be in My Heart" by from Tarzan. And like, there was not a dry eye in the room. Like, everyone was sobbing. Like, it makes me want to cry just thinking about it, just because not only were the lyrics like so poignant, but just to see like him so confident and to be able to get up there and sing just kind of was a beautiful capture the essence of that is who is Beck. So I am just so grateful for the team at Bonheur that has given us our child back, and that we're able to give him the support that he needs to be the best and continue to be happy and to bless others. And also, I hope that we can be a light to other families and encouragement to fight the good fight and not to give up. And so our whole family has embraced that, and that is our hope.
Beautiful. Well, I hope that I get to come see Beck perform when it's on my list of things. So I'll make it out there one day to come see him. But I really want to thank you for coming on. I mean, you shared like curveball after curveball with you, with Beck, your family. Thank you for being such a fierce advocate, not only for Beck, but also for so many other children whose families are connected with the Pediatric Epilepsy Surgery Alliance and that Facebook group that you run, and the mom's trip to Zion. That sounds amazing. Thank you for being you. And I really appreciate you coming on, telling your stories. And I hope you come back again. I know that Beck's story is not done, and you are continuing to be an amazing advocate that you are. And I just really appreciate you for coming on. Thank you.
Thank you for having me.
Thanks for listening to Curveballs and Lemonade. If you enjoyed this episode, be sure to follow and subscribe so you never miss a news story. New episodes drop every Thursday. Follow us on Instagram at Curveballs and Lemonade and on Facebook. For audio listeners, make sure to check out full video episodes on YouTube at Curveballs and Lemonade. Engineered by Robert Altschuler, Curveballs and Lemonade is produced by Command Creative Studios.